Governor, your first question is from Marcia Kramer of WCBS. Marcia, please unmute your microphone. Your line is open.
I'm unmuted, Governor. Can you hear me? I'm unmuted, Governor. Oh, I see you going, I can't hear you, but you must hear me if you're like that.
That's very good. That's very good, Marcia.
You know, my eyesight hasn't failed me yet.
How are you?
I'm good, thank you very much, Governor. So I guess the biggest question that people have is this the next step in terms of reopening Broadway? Will Broadway theaters or any number of Broadway theaters be considered in the second phase so that you can, if with testing, get some of those theaters open as well?
Marcia, I think that is where we are headed, right? The overall effort is headed towards reopening with testing. And we're going to be smart, but also aggressive about it. The Buffalo Bills game, Buffalo Bills playoff game, 7,000 people in a stadium, all tested prior to entrance. No evidence in contact tracing of any increased spread. 7,000 people. Now, stadium was outdoors, but it's 7,000 people, and you tested all the 7,000 people. If you can reopen using testing, take it to the next step. We just said catering halls, wedding ceremonies can go up to 150 with testing, right? Which is safe from a public health point of view. And by the way, it will give people confidence to actually go to the wedding, right? You invite 150 people to a wedding now. Who wants to go stand in the middle of 150 people? But if you say all 150 people were tested and they're negative, well, then I would go to that wedding. So testing as a way to reopen. We're going to start to expand that. You saw it in the arts. There are venues that we want to start to reopen with testing and capacity limitations. And I'm going to be speaking more about that in the coming days. And then, yes, theaters, arenas, why can't you do it with Broadway? You can. You can open a Broadway stage with a set percentage of occupants where people have tested prior to walking into that Broadway theater, both, again, from a public health point of view and a practical point of view. Would I go see a play and sit in a playhouse with 150 people? If the 150 people were tested and they were all negative, yes, I would do that. And the social distancing and the air ventilation system is proper, yes, I would do that. If it was reviewed by the State Department of Health and they said there was an intelligent protocol to it, I would do it. So I think reopening with testing is going to be the key.
Do you have a time frame for that, though?
We are already moving, right? We started the demonstration at the Buffalo Bills game. The wedding ceremonies, catering halls, that's just 150 people with testing in the right space. And if you can do a wedding catering hall at 150 people with testing, well, can you do a Broadway theater where the size would allow 150 people with social distancing with testing, right? Whether you're at a wedding or you're sitting in a seat in a theater, what's the difference? So that's what we're working through now. And we're moving down this path. We're watching the infection rate, right? And it's always a calculation. That graphic that I do, that I know you don't like, with the valve that says you reopen the economy while you're watching the gauges, and the gauges are infection rate, hospitalization rate, et cetera. That's what we're doing. I don't have a timeline for you, but we announced, we had the Buffalo Bills games a couple of weeks ago. We then announced the catering hall wedding ceremonies last week. This pop-up arts says it's going to lead to venues like the Shed, like the Harlem Theater, et cetera. So we're working down that path. I don't have a firm timeline for you, but that's the path we're headed while we're watching the infection rate, hospitalization rate at the same time. One hand on the valve, one eye on the gauges of the infection rate, et cetera. One hand, one eye doesn't really work, but I hope you get the basic point. A.J. Parkinson said one hand and one eye is really all you need. Thank you, Marcia. Next question, operator.
Thank you, Governor. Next up, we have Gabe Gutierrez of NBC News. Gabe, please unmute your microphone. Your line is now open.
Hi, Governor. How are you? Thanks for taking the question.
Thank you, Dave.
So, Governor, I get that you've said that, it's important for public officials to be nimble, flexible, and that the coronavirus changes tactics. But, there have been some questions about how you reversed your position on restaurant workers being eligible for the vaccine. And it took a few days for the screening website to reflect that. And on Friday, as you mentioned earlier, you announced hospitals would have a week to vaccinate the rest of their workers. That caught some people off guard. And the comorbidities that you announced in that tweet on Friday have yet to be reflected on any of the screening websites. You said earlier you'd have to wait until the 14th to make those appointments. But Governor, what would you tell people who say that the entire process is too confusing or that you're winging it?
Then they don't, I would say, Dave, they don't understand where we are. There is no plan or strategy that does not adjust to the virus and the circumstances. And the virus changes. And by the way, if you don't change with the virus, you lose. You lose. You have two variables: the infection rate of the virus, by the way, variants of interest of the virus, hospitalization rate of the virus, effectiveness of the vaccine against the virus, right? That's one cluster of variables. And then you have the supply of the vaccine and how much you're getting. And those two variables change, you have to change. You are responding to variables outside of your control. I don't control what COVID does. I don't control the infection rate. And I don't control how many vaccinations we get, how many doses we get. I can just react to those changes. We talked about 11 times before the holiday season, don't celebrate smart. If you have large social gatherings, you're going to see the virus increase, you're going to see the virus increase, you're going to see the virus increase. The number went up. What did we have to do, Dave? We had to adjust to the COVID increase in infection rate. Well, why didn't you just ignore it? Because if we ignored it, it would have overwhelmed the hospitals, more people would have died. Well, why didn't you stay consistent? Because the facts changed, right? You're planning to stay home today. Somebody walks in the house and says, the house is on fire. Why don't you say, well, my plan is to stay home, so I'm staying home despite the fire? Wouldn't be smart. So you adjust to the increase in infection rate. How many vaccine doses do you have? I can tell you what I have next week. I can't tell you more than that. Now, if Washington tomorrow announces we're going to get more dosages, you know what we're going to do? We'll adjust to that new fact and that new information. And if our doses increase 5% tomorrow, then I'm going to have a new plan as to how to use that 5%. That's called intelligent. Adjusting to the plan. Yes, you adjust the plan when the facts change. You're staying home today, Dave? The house is on fire.
I-
Next question.
Plan
operator.
changes.
Hold on a
I
second.
understand.
Melissa,
Thanks, Governor.
Melissa has an analogy on my house is on fire.
I don't know that I have an analogy, but I was just going to say to the governor's point, you know, we woke up, I think it was 2 Tuesdays ago, and we had a plan, and then the CDC went out and announced you should do immunocompromised and 65 plus. Maybe it was 3 weeks ago. The days all run together. But immediately the public and the press says, what are you going to do? What are you going to do? What are you going to do? And we do our best understanding the demands of the public, wanting information, wanting answers. We sympathize with people who desperately want this vaccine and who are eager to get more information as to when they can go, when they can sign up, when is it my turn. But to the governor's point, we are in a position where we are reacting to things that we are directly out of our control. So we're doing our best. On Friday, we said it was going to be the 15th. That's the most lead time I think we've given on almost anything during this pandemic. I remember early on, we announced in the morning that the entire state was closing that night. But it's going to continue to be a push and pull and a frustrating process, and we ask the public just to be patient, and we're doing our best. And as the information changes, you are going to see changes coming from the administration. As we can get more vaccines out there, we are going to be adding to the eligibility category. And everyone here is just striving to make sure that every New Yorker can get on with their lives as quickly as possible, which I think is what we all want and need.
Yeah, and Dave, let's not lose all intelligence, right, and all common sense. When the federal government announced we were getting 10% more vaccine doses, then I said we have more doses available, and we added restaurant workers. We are now, I believe, at our max on hospital workers, where we're at about 75% of hospital workers have received the vaccine. We're at 72, 73 about 10 days ago. I don't see that number going any higher. We do have an issue why the low-performing hospitals were so much lower. But let's free up those unused vaccines. I'm not going to leave unused vaccines on a shelf waiting for hospitals to get past the declination rate. So you adjust to those facts. The White House controls the supply. They've increased it once. We're going to have a conversation tomorrow. They may increase it again. They may reduce it. Depending on what they decide, we will then change our plan. So yes, well, there's a lot of changes. Yeah, welcome to the war, my friend. Next question, operator.
Thank you, Governor. Your next question comes from Sandra Tan from the Buffalo News. Sandra, your line is now open. Please unmute your microphone.
Hi, Governor. Thank you. I had two questions. First is, if an otherwise healthy individual falsely certifies that they have some underlying condition like diabetes or high blood pressure, would that individual face any consequences for getting the vaccine under false circumstances? And my second question is, the state's vaccine tracker shows how many doses have been administered in each region, but not how many people have actually been vaccinated. The site also doesn't provide any breakdown of how much vaccine is being delivered to different parts of the state and to which types of distribution sites, like hospitals or pharmacies or local governments. Given the interest in vaccine distribution, is that something, is that information that can be added?
Yeah, I have to check, maybe Larry or Dr. Zucker or Melissa can speak about the vaccine tracker. On your first question, look, everybody wants this vaccine. There was a lot, when this started, the skepticism about the vaccine was very high. And by the way, the skepticism about the vaccine is still high and is higher in Black and Hispanic communities. And it's a problem, and we have to deal with it. But when it became so rare and hard to get, there was like a shift where the demand went way up when people knew they couldn't get it. When it became rare and precious, then more people wanted it. So you now have roughly 10 million people every week chasing 300,000 vaccines. And you have people who sit on a computer all day trying to get an appointment for their mother or their grandmother or their grandfather or their brother or their sister. And they just sit there hitting the refresh key, and they look at all different sites from county government, state government. They're making phone calls. You have people who are desperate, right? Because they've been at home, they're locked up, they're afraid. So it is a precious resource. It is so precious that I believe some people will commit fraud. I was a former district attorney. I was a former attorney general. You tend to view these situations with an eye towards when you have a scarce resource and high demand, what might happen? There may be fraud. We've already seen cases of people selling the vaccine wrongfully, stealing the vaccine. It's a valuable commodity. People would pay a lot of money for a vaccine right now, some people. So yes, if fraud is fraud, and we've asked the people of this state to be reasonable in prioritization, and I feel good defending the prioritization. People in nursing homes, yes. Staff in nursing homes, yes. Staff in hospitals, yes. Essential workers, yes. 65 plus, yes. Comorbidities, yes. I feel good with all those prioritizations. I'm 63. I'm not 65. I'm an essential worker. I said I'm not going to take it as an essential worker. So I'm not in any eligible category. If a person commits fraud and says they have a comorbidity when they don't, or lies about their age, then, yeah, they committed fraud, and that has to be enforced. Otherwise, the whole system's a mockery. On the tracker, I don't know. Do you know, Melissa?
Yeah, so the tracker, which we're continuing to build out, it's been a work in progress, much like the original site when we had testing and the mortality information, and then we added race. So we're going through that process again right now. I know it's not as fast as some in the public and the press would like, but we're working on it. Over the weekend, we added demographic data broken down by subcategories, so you can see the race and ethnicity of the consumption of the vaccine by 1A and 1B and 65 plus. We also added the hospital tracker, so you can see the hospital workers by region and broken down by county at the county level, and the nursing homes. So yes, we will continue to build that out. I will take back those specific ones today, and I'll see how quickly we can get them updated on the website.
Thank you.
We're also, just to be clear, whatever doses we have, every dose is precious, as I just explained. Every dose is precious, so we want to make sure every dose we get is in an arm. Slow performers versus high performers, we give the vaccine to higher performing distributors because we don't want to provide the vaccine to a distributor who then is slow in actual vaccination. If there are any excess doses, we're working with the federal government to get approval to reallocate excess doses. In other words, we participate in a federal program that has pharmacies doing nursing homes and nursing home staff. And part of that comes from the state's allocation. So CVS gets an allocation to do nursing homes and nursing home staff. I believe there's an excess allocation in that program. How do we reallocate excess allocations? Second doses. Some people won't come back for their second dose. I get all the scientists say, give the second dose when you're supposed to give the second dose, which means don't use the second dose as a first dose. I get it. Everybody has to get the second dose at the right time. I understand that. But somebody doesn't come back for the second dose. how long do I have to hold the second dose? There'll be some people who don't come back, who forget, who just hear something else in the meantime, who change their mind. How do we use those excess second doses? That's something else. So we're constantly scraping and scratching to get any available doses and getting them to the fastest distributors. Frankly, the single fastest distribution mechanism are the mass vaccination sites. If you're talking about just throughput, those are the fastest mechanism to get the vaccine in the most number of arms in the shortest period of time. Javits Center, Yankee Stadium, Jones Beach, Stony Brook, mass vaccination sites. Next question, operator.
Thank you, Governor. Next up, we have Sonia Rincon from 1010 Wins. Sonia, your line is now open. Please unmute your microphone.
Hi, Governor. Question about New York pops up and the performances and performers. Will these be union performances? As you know, many union performers now no longer qualify for their usual health insurance because they barely worked in 2020, and unions help set safety guidelines.
I would have to, Sonia, first, good to hear your voice, Sonia. I do not know is the honest answer. So I would have to check. The question is, are all the performers union performers? I don't know. I will check and I will have them get back to you.
Thank you.
Next question, operator.
Thank you, Governor. Next up, we have Narmeen Chaudhry from WPIX. Narmeen, your line is now open. Please unmute your microphone.
Thank you. Hello, everyone. I want to ask you a bit of clarity in regards to the healthcare workers. You essentially said this is a final week for hospitals to get their healthcare workers to get the vaccines that have been allocated to them. But a point of clarification, could they change their minds? Do they have to go through the state like everyone else when it comes to that time that they perhaps want it later on? Also, I want to slip in one more quick one. Long Island, you've mentioned for a couple of weeks as being a problem area, but I have not seen them included in the micro-cluster strategy yet. Is there intention to do so?
Yeah, I only heard about 1 out of every 4 words. So I think I get the gist of the question. The healthcare workers, a hospital has had over 8 weeks to vaccinate their healthcare staff, okay? And these are people who don't have to go anywhere else. They're in the hospital, just come to in the hospital, give you the staff in the hospital. I have been pushing every briefing, hospital management to get as many hospital workers vaccinated as possible. We're up to about 75%, which is good. When we started, we were like in the low 60s. There is going to be a percentage of people who will not take it, and I understand that. There's a differential now between the Black and Hispanic community that has a higher declination rate than the white community. We're working on that. But you're at 75%. Is the declination rate about 25%? Maybe. But it's been 8 weeks, and we've done everything we can, and we're going to use the excess. Anybody who changes their mind, we get from the hospitals on a nightly basis how many people are on their staff who have not declined and would take it. And we'll make sure anyone who will take it will have the allocation. We just don't want to allocate more than we're needing. That's true on the hospital program, that's true on the nursing home program, and that's true for the second dose program. Allocate what you need, but not more than what you need. Hospital worker who changes their mind, the hospital says, I need some dosages for them, and the hospitals will continue to get an allocation, just not as great as they have been getting. The nursing home program, I believe there is excess in that program that we can reallocate. Second doses, I believe there are some people who are not coming back for the second dose. And I believe we can use, better allocate that excess. So we're doing that across the board. Let's take one more, please. Operator.
Thank you, Governor. Your final question comes from Andrew Siff of WNBC. Andrew, your line is now open. Please unmute your microphone.
Good afternoon, Governor. So with regard to making appointments for the comorbidities, if I understand correctly, your website will open with that as a possibility on Sunday. We're talking about potentially millions of people in these categories. How ready is the state's portal to accommodate that? And should people expect it to be sort of sold out and filled up almost instantly?
I think, Andrew, I will confirm either Melissa or Larry or Howard or Kelly on the time it's opening. Look, you are right, and let's state it even more bluntly. 10 million New Yorkers are chasing 300,000 vaccines. 10 million New Yorkers are chasing 300,000 vaccines every week. That's what's happening. So, yes, expect the portals to open, expect the appointments to be booked very quickly, and this will be an ongoing tension until the supply is greatly increased and dramatically increased. Look, if you got the supply up to 500,000 a week, right? You're still talking about months. So yes, this is going to be a long, anxiety-producing time. Well, how did we get here? I don't know. Why the federal government didn't order enough vaccine last year is one of the great questions in life. Operation Warp Speed, if you remember, was the federal program that was doing the vaccines. How we wind up in a situation where the taxpayer spent billions to expedite the vaccine, except we didn't produce enough. I don't know. But that happened at a federal level. Melissa, Larry, does anyone know about when the appointments open up?
They're going to open up on the 14th, so it'll be that morning. I anticipate it'll go live just after midnight. There will be a crush. This will not be perfect. We've made a lot of changes since the vaccine website initially launched to be able to handle much more volume. I think the system itself has smoothed out. There are people constantly on a daily basis right now, hundreds of thousands of people on that website refreshing. That traffic is only going to increase. As a reminder, you can also do this through your local health department.
She's given me the goods that I wanted on this.
Say it again, Andrew?
Sorry, Andrew?
Andrew was talking to someone else.
Well, in any event, the local health departments are also going to be doing this. As the governor said, we're taking the allocation that was going to the hospitals that have finished their hospital workers, and we're giving it to the local health departments. And so you should also be consulting with your local health department in the city. Obviously, the city has a lot of city-run sites on how they're going to do this. They may be doing it differently. We're giving them that flexibility. So the state sites are going live on the 14th. The local health departments will announce on their own how and when they're going to take appointments. And so be looking to your local health departments for that guidance as well. But everybody should go into this with their eyes wide open. It's going to be frustrating. It is going to be a crush. There are going to be problems. It is not going to be perfect, and everyone's going to do their best to try to, in real time, catch glitches and get things up and running. But it's going to be a tough period here.
Yeah, and again, Andrew, calibration of expectations. I said when we announced this, I announced Matilda's rule, right? We knew this was going to happen because the federal government said they were going to increase the supply, and then they never did. And Matilda's rule was understand the reality of the situation. 300,000 people chasing, 10 million people chasing 300,000 vaccines. That's the reality. That's not going to change for months. for months. So if you think, well, I'm eligible, well, that means I can get one next week. No, because you still have to deal with the fact that there are only 300,000 doses and 10 million people chasing the 300,000 doses. That's the difficulty in this situation. That's the difficulty that the Biden administration inherited, by the way. And what you'll see is people's patience will get frayed more and more because this is going on for months at this rate, 4 months. So Melissa's point is patience. Yes, patience, and they need to understand the facts, why this is happening. It's not because there's a portal problem or a software problem or it's because you have 10 million people chasing 300,000 vaccines every week, and that's not going to change. Okay, thank you very much.